Mississippi has the highest rates of preterm births in the country. In our capital city of Jackson, the numbers are even more alarming. Nearly 1 in 5 babies is born preterm. For expecting mothers, navigating these odds can be daunting. Morgan Gill explores their challenges and the solutions healthcare professionals are working towards.
Mississippi received an F rating on the March of Dimes 2024 report card, underscoring a critical maternal health crisis. For Annalyn Witt, Director of Health Services at the Mississippi Department of Health, these statistics aren't just numbers, they represent lives at risk. She emphasizes early and consistent prenatal care is key to reducing preterm births, but notes a glaring obstacle, the lack of adequate access to care.
We need to make sure that we're having different maternal and neonatal levels of care across the state and that they are available and accessible to all women and children.
Another challenge is the state's maternal care deserts. More than half of Mississippi's counties lack a hospital or clinic offering maternity services, forcing mothers to make tough decisions. For Forest County resident Jessica Downs, those choices led her to have one child in a hospital and another at home. She vividly recalls the difference between the two experiences.
I think back to, like how I said, everything was very rushed. With the hospital, for example, I was given Pitocin unbeknownst to me. I had no idea. I woke up and they were like, hey, we gave you Pitocin. And I was like, okay.
Jessica's story highlights the deeper struggles many mothers face. And for Black mothers, the stakes are even higher. The CDC reports that Black women in Mississippi are 3 times more likely to die from pregnancy-related causes than white women. Black infants account for 59% of the state's infant deaths, despite representing just 43% of births. These disparities are linked to unequal access to health care, chronic conditions, and the effects of systemic racism, according to the CDC.
You would think that in Mississippi, given our higher percentage of Black mothers, that we would be highly focused on how to improve that. And I do know that there are efforts to improve those numbers, but it's going to have to, systematic change is going to have to happen.
I'm Morgan Gill, reporting for the Roy Howard Community Journalism Center.
Maternal health advocates believe that improving access towards health care, increasing funding towards maternal care programs, and passing legislation to regulate and recognize midwives could save lives.